All right. Nice to see everyone. I'm going to just go to my agenda real quick. And so the first thing on the agenda was the joint proposal with the Quality, the QI and Safety Committee. We had made that proposal. It wasn't accepted. So I hope maybe next year we can do something different. Okay. And then the next thing on our agenda is about, what we're doing with an APSA. And for this one, the first item would be the academic environmental site selection rubric draft that I'm working on with Colleen. And I think now Colleen's working on it. We're going to put some citations into it. Colleen, do you have any updates with that? Sorry to put you on the spot. I don't hear her. Do you guys hear her? No. Colleen, I see you're unmuted, but I don't hear you. Okay, we'll circle back. The next thing would be, oh, having mic issues. Going to try relogging on. Okay, cool. Yes, thanks. And then there's the carbon offset credits. Let's table that since we're like going right up into APSA 2026. We'll work on that again as we get past the 2026 meeting. And then, all right, now to the interesting part. I'm going to share my screen and then Sarah King, you there? I see you. You're on mute.
Yes, I am. Sorry. Just
Awesome.
scarfing some food.
Sorry, you guys. Okay, now I need to get to this bar down here, which, okay. So we're working on this document, this one. Okay. Oh, actually, I should pull up your 2-minute turnover.
Mm.
So Sarah put together, as you guys remember, last year we put together a 2-minute turnover proposal, and I think it was helpful, and Jen agreed to let us do it again. So Sarah went ahead and put this together. So all right, Sarah, you want to go through it or?
Yeah, sure. So I really tried to just mirror what we did last year, just obviously with Chicago based as opposed to Montreal. And so went through different travel things that we'd already kind of brought up. And then the map I use is of all of the, public transit that they have, but specifically highlighting the airports.
This is good. Where did you get this from?
The CTA website.
Okay.
And then I just put the circles and arrows or in star on it.
Yeah, it's good.
Um, and then if you keep scrolling down, um, so I had a couple links for like other, ways to get around town, things that are walkable, other methods. And then I wasn't sure if we were using the same app as before. I assumed so, but I just left it as event app. As far as like printing things were not. And then we can add in the specific app information once that's confirmed. The water bottles, I basically quoted from the website for the hotel, for reasoning.
Mhm.
Similarly, we had kind of talked about, I brought up before the any unused toiletries and things about collecting them for donations. So the hotel actually already does that, apparently.
Okay,
I
great.
don't know where they donate things to. I refrained from reaching out because there's a couple of questions I could have clarified, but I didn't want to reach out on behalf of APSA necessarily. So if we want to give more information about like where those things are going, we could add that. Then let's see. Again, some of these are just taken from before. Same with like the house cleaning thing. We mentioned that before, but I sort of used the language from our hotel specifically. I really liked this for the recycling and compost. I liked this. I took this from a different website that's based in like Maine, maybe. My only question with that is if they already have their own signage, it might be helpful to copy that so that people can readily recognize it, just so it's consistent.
I don't think they do. Jen took a picture of their recycling sort of like trash thing, and it's like a three compartment trash recycling compost, and there's no explanations anywhere near it.
Okay.
So I don't think that they have anything like this that gives more detail.
Okay. And the other option that we could do is, this is sort of like this an example, but I could take this and make it our own. So it's like APSA branded if we wanted and or
Yeah,
put
I'm still in
in
the building, so I'll tell Erica Rosenbaum.
The question is, it says all hotel to go. Sorry if there's noise in the background, guys.
yeah, no
I'm in the
problem.
lounge. All hotel to go containers, cups and cutlery are recyclable and compostable. Do we know if that's like Sheraton or is that?
That's the hotel. That's a quote from their website.
Oh, okay.
So other thing I was thinking is we could make the once if we have a better idea and maybe it's not feasible, but making the signs reflect the actual things that we might have at the meeting. For example, the cutlery and things like that, or pamphlets, or parts of the lanyard that would not be recyclable, would have to go in trash or something, just so it's more exact. But I don't know how necessary that is. And then I went through, and these are again from the last year's 2-minute turnover as far as like examples of things that fit in each category. And then last but not least were the local eateries and things. And so I know that we talked today briefly about it. Jen has a different link that we'll add. And then I added the one from the hotel. And then we can get rid of my other one and put Jen's in, I think.
Yeah. Did anybody have anything to add about what Sarah's put together here? We can go back to the top, but go back to the travel. It feels like it's like in sections, so like the travel part.
Do you have a restaurant section or is that coming up?
So the last bullet point has the links to the restaurant. They're like a list of restaurants. We could also flesh it out more and list them individually if you wanted to. I
Yeah.
also doesn't
So
really matter.
yeah, this one's the one that Sheraton posts.
Mhm.
And then Sarah had put this one.
It was like a blog thing I
Yeah.
found.
But although it's September 16th and it looked like it was updated 2026, like this restaurant, like which one? So, one of them was closed completely, and then these were really far away. This one was the only thing that was close, actually. This one was really far away. This one's really far away. I guess let me show you what I mean by far away. Maybe like my conception of far away in New Jersey doesn't mean anything anymore. So, um, okay,
No, those are far away.
okay.
Like,
Win. Is that win?
yeah, I think Lynn was
There
gonna
you go.
say the same thing. Like,
Oh, okay.
Yeah,
those are far away.
Oh, okay. Hi.
I have like a personal list of restaurants that those, yeah, that's really far. I have like a personal list of like sustainable restaurants that I'm happy to share.
Okay.
There, a lot of them aren't like quite near where the Sheridan is. They're a little bit more out in the neighborhoods, but would be relatively accessible if people like were willing to travel out a little bit. But there's some really neat spots around the city that do a good job of sourcing locally and really kind of practicing kind of sustainability in there as part of their mission. So I'm happy to put those together and share those. They might just not be close to the Sheridan.
Yeah, could you share them with Sarah? I think that would be good.
Yeah, we can totally add those on. Because I do imagine, I mean, obviously in the ideal world, only walk to the places that we want to go. But I think people, especially in a place like Chicago, are also going to want to potentially explore elsewhere. So even if you have to Uber or take the bus or, if people drive into town, if they want to drive somewhere, I think having other options that are still, you know, organic or, locally sourced or still considered better for the environment, even if it takes a little while to get there, would be useful information.
Yeah, I can also put the closest like train line stop as well, because most of them will be accessible by the L, which would be relatively easy from the Sheridan.
Yeah.
That'd
Yeah.
be awesome. Now, Jen did have they worked with CVB in Chicago and they put together this lunch option, this one, which is on the website, I think. The only problem with this one, guys, is that none of these restaurants, I looked up the ones on this column, have any sort of sustainability or eat local or, zero waste or whatnot mission. They're a pizza place, there's pubs. I'm sure they're lovely and wonderful. There's one I saw that was like Shang Noodle Chicago's. I'm sure they don't caring about sustainability. But you know, that was the only thing with the list that Jen had put together. I mean, I know they partnered with the CBP and what do you guys think?
I mean, these are all chain. I mean, like Yoke is like sort of a chain. Hampton Social is sort of like a Chicago chain. La Briella is like a chain. Um, I think they did the best they could, and they were probably looking for what's walkable. So I'm not sure that people would travel, but I don't know.
Yeah, I
No,
would probably, you could maybe have like two sections, like one of things that are within walking distance. And from that perspective, would be considered low impact since groups can easily get there without having to take Ubers or other transit. And then we can curate a list of like the really cool, neat restaurants for anyone who wants to get out a little bit more that have some kind of like low impact type of mission.
I love that. I think that's a really great way to spin that. Yeah, because these are all like I think they're all like within walking distance, very close. Um, okay. What do you think, Sarah?
Yeah, no, totally. I mean, that was a little bit of what I was looking at with the blog one is sort of, places that were specific to being more like green, locally sourced, sustainable mindset, even if they weren't close. But I think having places that are walkable specific is, of course, also has its own benefits, even if they are more chains or something. Not everywhere can be perfect. So having maybe like two sections for that, I think is a good idea.
Perfect. Okay, and then what do you guys think about the signage that Sarah was talking about? Everything's optional, right? Like we're trying to add. Um, but what do you guys think about like Sarah making a sign and
Sorry, I haven't been on many of these meetings. Tuesdays are always hard for me, but this looks pretty cool. I was just curious if we wanted to add like a fact for people that may be related to the hospital to like make it even cooler, like compost. Does your hospital compost? Like X amount of food waste is wasted at the hospital. Like recycle. This is so great. Can you recycle more? I don't know if we want to like add healthcare specific facts to make it a little exciting or if that's like way too much. And I get it if it's way too much. And I can help get some of those facts if we want. Because like I know like one big thing at Rush is that we don't have a good system in place for it yet, but like the sustainability team actually collects all the kitchen waste and then drives it over to the compost place themselves, which is not awesome for them, but like they're so passionate about it. It might be, just to spark thoughts.
that's amazing.
Yeah.
That's amazing. Um, I guess Sarah, was your thought then we make something we like change this Black Earth Compost logo to like APSA or something like that. And then this is like a poster that we have at 2026 and also 2027 and also 2028. Like, is that what you're like that sort of thing?
Yeah, well, I was imagining it being like my head was just like having it at the receptacles so that people know what goes into which bin. Um, and that would just be something that we could carry forward and yeah, make it an APSA version or whatever, just so that we're not completely stealing. But I think the idea of putting little tags with like fun facts, if you will, about the impacts in hospitals could certainly be like thought-provoking, kind of like Amy said. Like little questions to make you think about it more. I have a thought of thinking maybe that also could be an interesting thing to like, I know sometimes, in the background between talks and stuff, they'll like flash up whatever advertisement or quote or whatever. That could be something that maybe also could go up there to get people to be like, whoa, that's an interesting thing. Because when they're actually putting their things in the receptacle, I just don't know if it'll trigger or not. But I do think that's a good idea for getting people to think about the impact we're having.
Again, I thought you go in on mute, but okay. Um, okay, so yeah, I really like that idea about posting the sign on the PowerPoint between sessions. Because I feel like then you could change it because like maybe we're at a like now certified compostable tableware applies to Sheraton, but like maybe the next hotel that we're at, um, we maybe don't want to prominently show forks, knives, and plates because those are not compostable. At the next place, we could tweak and move things around. Or if you were thinking to make it a little bit more, I think you're saying like pieces of the lanyard or something like that, make it a little bit more tailored, then it could still be changed. Um, Also, there's probably more than one trash can. I'm just thinking about Montreal. There's at least two big wings that we were in, so we'd have to make more than one sign. I don't know how many signs we'd have to make or ideally make. So we'd
Yeah,
have to
that's the
be.
other thing is if it is something we want to be able to change, then obviously printing out signs is not as great versus doing it as like a generic, kind of like what this is, more generic, and then just getting like laminated. Let's say we get, print 20 or something and laminate them, and then you can use them year and year and year.
Mhm.
Kind of goes both ways versus putting them up in some sort of virtual form, of course. I don't know.
Any other thoughts? Sarah, I know you're like passionate about the sign. You've like been bringing up this sign from the very beginning. So I think maybe we should go for it. And between the APSA sessions, maybe we can give it to Jen for them to hold on to because they're going to be, or do you think you'll hold on to it? What if you don't attend the next APSA meeting or something like that?
Yeah, no, I feel like Jen would be the appropriate if she is willing and able, but
All right. I love it. Okay, so then Amy will get these healthcare related facts, thought-provoking questions to help add to the poster, and you'll put something together for that. All right. Anything else, guys, that you guys were looking at this and thought about? We did put out something very similar last year, so it's not the first time we've seen something like this before. Okay. And then when we have the neighborhood of local eateries or whatever, that list, one thing we had talked about last time was creating like a map with all the locations pinned, and then maybe changing that map into like a QR code that we could put into the app or have it posted that people could use the QR code and get to the map if somebody's like more visually based and they want to see it. Those see all the offerings that we've suggested on a map.
yeah, I like that idea.
All right. Okay. The other thing, guys, that we talked about last time was okay. You gotta hang with me here. Okay. We wanted to do something that brought sustainability more to the uh, mind of the attendees at APSA. So I think this idea came from was there like a scavenger hunt at another APSA or something like that? But basically, you take pictures and you post them to like Instagram with a hashtag. And so we were going off of this. So it's APSA 2026 Sustainability Bingo. And Sarah put this together. So Sarah, I don't know. I shared this with you. I don't know if you got a chance to look at it, but you're on mute.
Thank you. No, I like you jazzed up the language. I appreciated that for sure. But yeah, I just basically went on to like a free bingo card site and just had some ideas. And it occurred to me as I did it that trying to do it like over the course of the weekend, or week or whatever. So I made some of the things as being like, this is my water bottle, and then you take a picture of that every day. So it's not just like a 1 day thing necessarily. It can be over the course of the event. Also open to other ideas for what to include, but the one issue that we were talked about a little bit today, I think there's no question we can get the bingo card to be like a QR code or something that you can pull up in the app very easily, I think. I'm not sure the best way I don't know if there's any way to make it interactive. So, once you've clicked something, then you can click on that box and it is filled versus someone just has to keep track of that on their own. Because I do think having, a printed punch card or something like that sort of defeats the purpose a little bit. But open to ideas on how we can try to make that work. I just am not tech savvy enough. I'm sure you can make it interactive. Again, I just don't know what the capabilities are for that.
I have an idea, but before I go into that and totally lose you guys and get glass eyes all over the screen, I thought maybe we'd talk a little bit about just like this idea and what people thought about it. So once you get like bingo or whatever, we wanted you to be able to win a prize, which we talked about with Jen, like you could enter a raffle with your bingo card, and then we'll maybe like draw one person to get a 1 year free subscription to the pediatric surgery library, which I was like, oh, that would be big. I would love that. I don't know about you guys, or maybe like a discount code or something like that. I came up with discount code because I was just doing the registration for APSA and there was a discount code. I was like, oh, we could maybe do a discount code and maybe we don't give away as much money. But I think the pediatric surgery library is like hundreds, like a subscription for a year. So like 200 or 300 or something. I was like, I'd do it for that. What do you guys think? Goofball? Crazy?
I wonder if there's a way of actually building this into the Hoover app.
That's what I was thinking as well, Dr. Gow, and I gotta believe you can. I actually was I tried to look on their website and I couldn't find, basically you had to be able to have access to whatever you're paying for to be able to investigate more. But I did see there was a different, events app company that did advertise that they do something like this. So I gotta believe that what we use does too. It probably matters on what we are signed up for and also knowing who to talk to make it happen.
Yeah. All right, so I'll go over the idea that I thought in order to avoid like printing out a bunch of like, bingo sheets and like handing them out to people and then like, I don't know, punching them or stamping them or something like that. So, okay, so this is our card. Everybody gets the same card. And it can be with a QR code or whatever. They can pull it up in whatever form. And okay, so like on Friday, you take a picture of a do not disturb sign. One day you take a picture of yourself picking up street litter, and we can talk more about this because Raman had a project for that. Or you take a picture of you walking to a dinner photo and then you post it, hashtag APSA goes green on Thursday. Okay, so you get all of these, right? So my thought was that we need to have somebody who's going to be at the registration desk. Okay. And somebody comes up and they show, okay, I got a do not disturb picture on my phone. Okay. So then that person basically has a whole bunch of cards next to them that are like color coded red, green, red, yellow, green, or and blue. And I can't use APSA because there's two A's, but let's just use APSA for now, okay? So like the red cards have APSA, the yellow cards have APSA, the green cards have APSA. Okay. So the person comes up, they show me a do not disturb sign on Friday, and I'll hold up to them a card that's yellow and green. It matches this one. And they'll take a picture of it on their phone. Then the next day they'll come and they'll show us a picture of them picking up street litter. I'll give them a card that's green with the letter A on it. Okay, you guys getting me? And they'll take a picture of it. Or let's do a different example. They biked around town. They took a picture of them biking around town, so I give them a yellow P. And then I'm recycling on Friday, so they get a yellow S. And then the last one they do, I guess, on Thursday. They're recycling on Friday and they're recycling on Thursday. Great. So now they've got a yellow S and a yellow A. So whenever they've reached bingo, boom, they hit bingo and they think that they've done it, they'll come up to us and we'll have them show us their photos. And if you don't want me to look at all your photos, you can put them all into an album or whatever, but I'll look at your photos. And what I'm looking for is I'm looking for 3 pictures of yellow cards. Sorry, 4 pictures of yellow cards. If I see 4 pictures of yellow cards, then I know you got this one. If I see 4 pictures of green cards, I know you got this one. Does that make sense, guys? So I was just thinking like this might be a way to stamp, but not stamp. And you just use your phone as a stamp. And like, if we use color codes and spell out the word APSA, so there's different combinations. There's APSA in all red, APSA in all yellow, APSA in all green, APSA in all blue. And then if you go this diagonal one, then you'll have, APSA in the rainbow colors, or I guess this way too, rainbow colors. And then if you go this way, then you'll see 4 A's, 4 P's, 4 S's, 4 A's. Okay. Now this is the problem. APSA's got 2 A's, so then they could go this one, and then this one, and that doesn't go 4 in a row. So we'll have to change the letters actually to a different 4-letter code thingy, whatever. That doesn't repeat. Did you guys follow me, or did I totally lose you?
Or it could be like A1 and A2.
Oh, I was going to use your last name actually. I was going to go King. Okay.
Also,
It doesn't matter what letter it is, as long as it doesn't have like repeats.
I saw what the link you just said, Dr. Gao, that
Oh, what did he send?
it's funny. It's the same, the little advertisement they have on how they made the Matrix. It's the same website I used.
Oh, P-Surge. Oh,
But what I couldn't
that's a
quite
good one.
figure out is how they are saying you ticket in the app. That's the question. I don't know if you could figure that out.
I don't know. I just found it, so I didn't really kind of go in deep depth of it, but I'm sure we can ask our vendor. I mean, we work with Hoova, so I'm sure we can ask them.
Okay. Do you have a contact for us to?
I'm sure Jen will.
Okay, we'll ask Jen.
So if I'm totally honest, you did totally lose me.
Yeah, I figured.
There, the week has a different letter. Like
What's
Thursday, you get an A if you get your things done. Friday, you get a P. Saturday, you get an S. And then I'm just making up the days because I don't know when the meeting actually is. Sunday, you get the next day.
am I sharing screen or did I stop? Sorry, let me just share screen again.
Why not just go straight bingo in terms of like a row or a call? Like
Yeah. And the other concern that I have also, and I like the idea of like having different days of the week because it gets people to do different things, but not everybody's there for the whole meeting. And so I don't know if we want to have like day specific things, because then some people may just be like, oh, screw it, I wasn't here for the whole time, I'm not going to be able to do this. So I just kind of balance those travel needs and restrictions that some people may encounter versus wanting to engage everybody to participate.
Yeah, that's fair. Or we could even just do it like as one, like time number 1, time number 2, time number 3 or something, maybe instead of days. Or unless people would get really creative to make every box completely different, because that was a little bit of my hang up.
Yeah, coming up with different ideas, right? I think that's why you didn't go with a 5 by 5. to do bingo.
Correct.
Yeah.
I went from, it was the 3x3 and I was like, well, this is silly. It's not enough. And then even going to 4x4, I was like, oh gosh. We have lots of creative minds who can probably think of more things than I could.
Yeah. You guys think of any other activities, or you can put them in the chat. Okay. So that is one of our ideas that one day for the sustainability bingo. The whole idea is just to get people to even think about this at all.
I was thinking the other thing is, so I think it's worth seeing who Jen knows who we can talk to at the vendor. Since they're advertising that they have this thing that maybe they can set it up that you can just click it on your phone, in which case that removes that potential confusion. The other version that we could do that's not bingo, but we could have it like if you use the hashtag, like you get a point for every time you post something that uses the hashtag, but it has to be something related to being sustainable, like the things that we put in the bingo list, like we can have examples. And then at the end, whoever has the most posts of doing separate activities would be the winner. Again, it's a little bit more open-ended, but if the bingo thing gets too impossible.
I also think it's going to be hard for us to maintain, like if we needed to have somebody at the registration the whole time.
Yeah.
You know,
Definitely if you could just get it done through the app, that would be amazing.
yeah, I think I would say either, you know, through the app if that works, or something like, you know, who accumulates the most hashtags and where we can define these are the categories of things that you can post, right? If you want to make it like, you know, give people ideas and say these are the things that will count, or we could leave it more open-ended. But I think the less manual work of somebody having to physically be somewhere throughout the whole meeting is going to make it easier to pull off.
Mm-hmm.
I was just going to put it in the chat. Maybe this is an idea much too far. But maybe there could actually be a table in the like exhibitors area, and we could be like, we're there between 12 and 4 and or 12 and 2 or something like that, and come get your like, I don't know, high five that you did it or something like that. And then we could even have like facts or papers or something at the table, like environmental, you know, sustainable things. Um, just a thought too, depending on like in logistics.
Sorry, say that again, Amy. I missed it.
Yeah. No, so I was saying that like, you know, in the exhibitors area, how there are all
Mhm.
those tables and booths, we could have a table and say,
Oh,
come get your stamp, sticker, take a picture, whatever,
I
however
see.
the bingo works, between 12 and 2. And then we could also have informational material if we wanted about sustainability, about pediatric surgeons' impact, or we could just stand there and talk about it, something like that. Um, maybe get more interest for a committee, for the committee, or if we even wanted to, I mean, it's double dipping and there isn't much time, but if we even wanted people to come by and fill out a survey or something like that, that probably won't go over real well with APSA at this late time period. So, I'll move away from that. But, you know, we could just talk about what can pediatric surgeons do to reduce environmental impact, and whether it's at meetings or whether it's at in the hospital itself or however.
Yeah,
Or highlighting like Practice Green Health or Project Spruce or any of those kinds of things.
If we
that's a great
have
idea.
showing up at the table, another bingo box thing, right? Like take your picture at the APSA sustainability table.
Good one. I like that. Okay. All right. Sorry, I keep going on share and off share because I can't see the chat box when I'm on share. So that's why I keep coming off it. Okay. All right, guys. I think that was, well, that's a lot of great ideas, more stuff for us to work on. I like it. Um, anything else, Sarah?
that was all for now. I appreciate the feedback and help. It's good to get more fresh ideas on it.
Okay, perfect. All right, so we're gonna jump over here to Ramen. Ramen's not here, right? Is he on? Speak up. Whoever, hold your peace. Okay, I guess he's not here. So I will talk about what he's planning to do. Okay, so Ramen wants to set up a cleanup project during the APSA meeting, and his goal is to put it during a time that's not like actually like during the programming. So like either during the lunch break, which is 90 minutes long. It's a bit of a long lunch break. Or like after when the programming is done for the day and like before the evening events. And his idea is like, we're coming to your city, we have using the resources here, but we want to like give back to the community. We want to, uh, do something to like, help you guys out. And so he did look into the Chicago River Cleanup Project win, but the problem is that it goes from Saturday 9 to noon, which is right during all the breakout sessions. And so I don't think that it'll fit because yeah. Then the other option is there's a group that kind of curates cleanup programs for smaller groups or groups, and they have everything from like you can borrow our idea, you can borrow our like cleanup tools and our trash bags and pickup tools and stuff like that to like a package that costs like $1,000 or $2,000, something like that, where they will, like basically like take you there and like take pictures and then like put together like some social media posts for you to like, I don't know, really advertise yourself. Um, we, I don't know, we weren't planning on doing the package with that, but maybe we could borrow their equipment. Um, Apparently it's at the Sustainability Museum, which is like across the river and like down a block, something like that. So it's actually pretty close. And Pickup Park. There's actually two parks. Okay, I'm gonna pronounce this name wrong, but sorry. Ogden Park and Cityfront Park. Ogden Park is like right across from the hotel. And Jen said when she was there, she saw it and felt that it might benefit from some cleanup. And then Cityfront Park is like one block over. It's a green space, but when I looked at it on Google Maps, it doesn't seem like it's really. Um, Anyways, it looks mostly paved and stuff like that. So I don't know if that one would be a good target. And then there was another idea to like take a river boat down to Chinatown and clean up an area around Chinatown. I don't know if we're going to get back for that on a lunch break though. Okay, so his idea was he do to set that up. He hasn't picked a time, but it seems like the Friday lunch might be the best one, the Friday lunchtime, or the Thursday evening, which ends at 5:30. That might be a possibility. Yeah. So if we do that, then, on the sustainability bingo, like, pick up street trash or something like that, that would be like right in line with that one. What do you guys think? Crazy?
I could also ask our sustainability team. They're really involved in the community.
Okay.
If there are any other ideas too,
Okay.
I'm happy to ask them. I think I wonder if Ramin got this idea from Clean Med, and I'm sure Colleen can speak to this a little bit more. They for Clean Med, they usually have people come like an entire half day early, and they'll do something where either they do like the history of a neighborhood, highlighting like different portions of it, including like the sustainability or lack of sustainability, and environmental justice topics. Um, and I think it's a great idea. Uh, I'm just a little worried about logistics because like it's like really well organized because like let's say we get a lot of trash at that park, like then we have to have a way to like clean up that trash or put that trash somewhere because like the trash, there's only one trash bin and we'd have to make sure the city is picking it up and doing all that kind of stuff. So I don't want to be negative, Nelly. I'm just worried a little bit about like logistics. And I can ask our sustainability team because it's stuff they do all the time. And we could also ask Maple because Lurie is so close. If there's some thing from their sustainability team as well that they do in that area. Because Lurie is literally like a couple blocks away. So they may have something that they already do locally that perhaps we could put our energy and effort into to help like boost their efforts or something like that.
Okay, that sounds awesome. Thank you, Amy. I think that's great. I don't know if he got it from Clean Med. He just came with the idea one day. I was very passionate about it, and
Yeah,
um,
I think it's a great idea. I mean, like, Clean Med really leans into it. They're like, what can we do in terms of environmental justice at our meeting?
mhm.
And they really heavily stress it, and it's pretty well attended. I think they've been doing it for a long time. Colleen's been going to Clean Med longer than I have, so you probably know more about it. But
I actually haven't been involved with any of those things because I've usually just like shown up on the day that the meeting starts. But it's actually a really kind of an interesting idea and maybe something we want to think about for next year. There's all these like pre-conference things, and it might be interesting. And I'm not sure I'm pulling the right APSA committee out of thin air to partner with, but like, do we partner with the Access to Care committee and highlight like a day of like environmental justice and access to care and how that actually impacts like childhood health and pediatric surgical disease. So long term for like next year, but that's actually would be an interesting thing for us to think about.
yeah, because I know in Chicago, not to belabor the point, there's like a toxic donut where they used to like all these factories and steel areas are there and like the rate of cancer from people who live in that toxic donut on the sort of southwest side of Chicago is like triple what it is everywhere else. And so it's like a known thing that like people are trying to research and study and stuff like that. So it'd be interesting depending on the city that we go to, like highlighting and understanding that. So.
Yeah. Actually, Robin's already looking at next year in San Diego. The Manchester Grand Hyatt is the hotel we're going to be at. It's on the waterfront, so he's planning to do like a beachfront cleanup sort of thing, or waterfront cleanup. I don't know if they have a beach. Is it beachy? Not really. Um, and I think getting on it early, Colleen, is like definitely important because we've already like so late into the game now that the program's already been made. So we can't like, because it would have been nice if we had told them that, this Chicago River Walk cleanup was on the Saturday. So don't put like, those events, maybe start them a little bit later or give us a block of time so that we could bring a group at APSA to do the Chicago River cleanup. And this would have been really great because we're like right on the Riverwalk. Um, so yeah, I think we should get on this sooner next year if we want to do it at San Diego. And we're going to talk with um, program director and hopefully get on the schedule. That was our thought. Ken, do you have any like thoughts, maybe a better way for us to approach it? If we talk to Dr. Fisher, is that the right person to talk to?
You're talking about who best to plan ahead on these things?
Get approval to plan ahead. If we wanted to do like a have it be like part of the pre-programming stuff.
It doesn't hurt to talk to Jason. He may not be that involved in anything outside the program, like in
Hmm.
terms of like the papers and that kind of stuff. I mean, I hate to keep defaulting to
Jen?
the support staff, but I mean, they're the ones that do most of the stuff surrounding and, organizing the meetings. So I would probably lean on them more than anyone else.
Okay. I mean, she seemed very interested in the idea of like cleaning up on the waterfront for San Diego. So, hopefully, yeah, we'll be something that will gain traction. I was also thinking about, if we're out there as a group, it'd be nice to do something or wear something that shows that we're all from the same group rather than just a mass of middle-aged, older people picking up trash. So I was sort of thinking about maybe scrub caps that have the APSA logo on it and something like APSA goes green or like, Pete Surgeon picking up your trash or like, I don't know, some catchy, funny um, phrase to put on there. Um, and anyways, for this year, I was just going to do one and give it to Ramen to wear. But if this is something that gains traction, it could be something like, sign up for it ahead of time. And then if you're going to do it, then you can, I don't know, buy or get whatever the thing so that we at least look like we're all cohesive and part of the same group, maybe, show up better in the photos. What do you guys think? Crickets. Okay, that's all right. We can move on. See. Okay, so I think the last part that we had was about the parental perceptions on, I'm gonna stop share. The parental perceptions um, on sustainability that Amy and Colleen are working on. You just sent out an email today, so I'll kick it back to you.
Yeah, I couldn't take another meeting where you asked me where we were on it, and I had done nothing. So I sent the email today. So I mean, I don't know if you want to speak more to it. Obviously, you've got the IRB and stuff, but I sent out an email to the people who had expressed interest. Certainly, we can, revisit or expand what that initial core group is going to be, but to just try and get an organizing meeting back on the calendar.
Yeah, and I can show you guys what the survey looks like and sort of what we haven't actually, I think we talked about this a long time ago and then we haven't done anything with it in a little bit. So I was looking at it today and sort of I would love everyone's input. We have the IRB in, but since the IRB is in, it's easy to change the questions. But my thought was, so how this all came about is that we had surveyed 100 general surgery patients just about like, do you care about the environment in your surgical care? Like, do you want to know about what our hospital is doing? Do you want to know if all options were equivalent? What the environmental impact of your choice is? And we were actually pretty shocked. I think I had mentioned this before, that a lot of people initially on the written survey cared about it and wanted to know about it, but then we went back and did we asked people if they would be willing to be interviewed, and we did a separate qualitative study. And I think we got this, I forgot where we got this paper published. I can go back and look at it. And in the qualitative study, they're like, wait, yes, maybe a lot more nuance to it. So some of the things that some of the questions that I was thinking about is like, we haven't really asked parents how concerned they are about the environmental impact of the things that we're doing on their children. So the IRB's in, we hadn't done much with it because was like, can I really do another single institution study? Snore, that's sort of boring. And I think also like different parts of the country may care about different things. And so I was thinking that it would be great to see if we could expand to a couple different parts of the country. And so I could share my screen, maybe, yes, and show you just some of what I gussied up the questions a little bit. And like I said, it would, hopefully you guys can see that. And it should be easy to just still, when we meet as a big group, modify this if we have questions about it. Probably not huge substantial changes, but just some like wording stuff. And then the idea was that we would just administer the survey to parents of patients waiting in pediatric surgery clinic, like they're waiting to see us anyways. And then we would ask them if they were interested in participating in a qualitative study. And if they were, that we would call them and have a short phone conversation with them, was the idea. And so the questions are just initially seeing how concerned they are about environmental issues, and probably have to expand out what are environmental issues so they understand that a little bit better. how concerned are you about the impact of the environment on your child's health? Do you believe environmental factors affect children's health? Just seeing what people think. And these questions are sort of modified after a SASE survey, which is the Six Americas survey. I don't remember what the rest of the letters stand for, but it's a sort of like a nationwide poll that they do yearly to see what Americans think about climate change. I think it's out of Yale. Um, but that's only in adults. No one's really done this for parents of children, specifically in the healthcare realm. And then two were perceptions of healthcare's environmental impact. Like, do they have any idea if healthcare does or doesn't contribute to emissions? Um, Obviously, we're giving them that awareness. So, did they know beforehand? Do they believe any environmental factors may have contributed to their children's medical conditions? Do you worry about the long-term impact? And then sort of like decision making. Um, would you care that a health system is doing this or not? And this is sort of a self-serving question, like we're always talking about how do we get healthcare systems and manufacturers to care about this and think about this. And then if your children required surgery and there were two medically equivalent options, would you want to know about the environmental impact? How important is it that healthcare providers take steps to reduce environmental impact? Do you believe hospitals should publicly report on it? Do you want your child's healthcare team to share information about it? And then just an open-ended question. And we could probably even make this a little shorter and make it 10 questions. But I'll stop talking and I'm curious to hear what you guys think.
I mean, I've been interested in this one from the beginning. So, and I was wondering, like, would you like let us get back our institutional data, like if we wanted to use it to help buttress any arguments in
Yeah,
our local area?
yeah, totally. Because I was thinking that probably we would, my research administrator would do a data use agreement sharing thing back and forth with each institution. And so I should be able, and we'd do it all in REDCap. So while we would do it, we could easily then compile reports and give it back to each institution, on the numbers that they get and sort of the de-identified qualitative data as well. So yeah, that would be ideal, I think, help everybody make the case that people care about this and people are thinking about this. And I'm assuming that they do care and think about this, but you know, I don't know. Maybe they will, maybe parents will, maybe they won't, and maybe it's different when they think about their own health versus their children's health. Like there's a paper I pulled up that yeah. I can share this paper out too. Like I could send it to you and we could send it out. That was done actually out of Blurry's about parental concerns about climate change in a major U.S. city. And parents were much more concerned and wanted pediatricians to discuss it with their family. I think it's always interesting. They were asking more about, just overall climate effects. And specifically, I know in Chicago, there's a lot of asthma and health and air concerns. So they were talking a little bit about this, but they wanted their pediatricians to talk to them about this. So I think it would be interesting to see like what is the role of the surgeon in that since we're arguably the biggest wasters in the hospital.
That last statement caught me though, because it's a really good survey. You can almost predict a lot of the answers and results. You can even do sophisticated zip code and geospatial zoning, so you don't actually have to ask about political affiliation and so forth. But that last part about it turning back to surgeons being the biggest wasters in the hospital is a bit odd. I mean, yes, the operating room contributes enormously to greenhouse gas issues, there's no doubt, but I'm not sure how the connection between the survey and that last statement get rectified.
Yeah, I think there's some areas in there where we can talk about best practice and like there was a I can't remember when it was, but there was a survey that, or there was a paper that looked at like the three different ways of doing an appendectomy, like endoloop and hook cautery, and single site versus, three port with a stapler. And it was mainly focused on cost, but the cost was much less with, I think this was just on the WhatsApp chat for those of you who are on the WhatsApp chat. I think that's where I read it. And it was saying that the cost is much less in a stapler because you're faster in the operating room than, initially trying to bungle around with doing a single site. I'm not sure that that's true anymore because I feel like now that I've done more single sites, I'm faster at them than perhaps a three-port appy. But factoring in cost, decision making, and I know for us, an endoloop actually is more cost to the patient than the stapler, because of like whatever contracts we have. But I think it's about raising awareness. At least, I'll air our dirty laundry. At Rush, they're doing simple, uncomplicated, healthy adults doing a robotic appy. Like, really? Like, really? We need the robot to do an appy? Like, this is bananas. And the argument is that it's training, whatever, we gotta let our residents get better at it, all of this kind of stuff. But I think there's has to be some awareness of what is also these other downstream effects, such as the environmental impact of what we're doing. So I realize it's a bit of a leap.
I don't disagree. I don't think anyone in this audience tonight would disagree
Yeah.
with you. And yeah, I'm all for it, and I want to have our group or region kind of sign on with the survey. But I still have a hard time connecting back to the surgeon and you doing your stapled appendectomy with a single port or somebody else doing a three-port endoloop appendectomy. We don't consent families for appendectomy with endoloops or staples or one versus three ports, right? I mean, we can get really down the dirty and fine line, and that's not what I want to do with my line of questioning.
Yeah.
I just the paper that you shared, which I know about, and is good because I think it raises awareness. It's really important. And I think Ken and others have mentioned a bunch of times through this committee and other similar that we got to keep bringing it back to pediatric surgical type things. So I just don't know how to make that connection tonight.
Yeah,
I think the
good point.
survey, I think the survey is good, and I think we should move forward with it. And then I think we need to do some soul searching and analysis.
Yeah, I think that's a really good point, actually. And we could make it more narrow and decide that we're just going to ask about, and perhaps this is more helpful or less helpful, about a specific pediatric surgical condition. Like we could make it just about appies, or we could just make it about inguinal hernia repairs, to like dial that in and be a little bit more specific, because it is pretty broad. So totally open for that too, as we think about it. Yeah, and I totally welcome that. I think that's why I haven't really pushed this forward, because I know that we're probably missing the boat a little bit on it and it's pretty broad. So yeah, I totally appreciate any narrowing or focus to it.
Were you going to do like a qualitative interview afterwards, like they did with that adult study, or you did with the adult study?
Yeah, absolutely. Because I think there's only so much you can get out of somebody sitting in a waiting room and we're just like, oh, these people are held hostage anyway, so let's ask them questions. But yeah, the idea is like they could opt into the study, and then they would just provide their phone numbers, and then we would do the calling and do the and get the qualitative transcripts and do all that kind of stuff. And so I have some questions for that too, but I think to Chris's point, if we narrow it or make it more specific or talk more about pediatric surgical care in some ways, then we could definitely change the qualitative questions to reflect that as well.
I don't want to take away from the initial thought of the survey, but related. What if you turned the survey and actually gave it to APSA membership? And you actually asked the similar questions, but then you actually honed in on the bread and butter of what we do and where you can have the biggest impact. Just like you said, taking for granted that yes, at your hospital, it may be far more efficient from an economic point of view to do a stapled appendectomy than endoloop appendectomy someplace else. And that might be the reason why a surgeon chooses one technique versus another. That might be parsed out in the end. But would that be more valuable getting the surgeon's response?
When did you do something like that? Or I don't know why I feel like may have been something you did already. Or
Yeah, we did are you talking about the APSA survey that we did? This was back in probably 2022, just on like a general
Yeah.
survey of surgeon like readiness and preparedness to um adopt and react to like environmental sustainability in the operating room.
Mhm. So now what is it? 22. So you're talking we do it now in 26, we put next year. So you got 4 years. Has all of this made any change or impact in people's choices? But you can hone in, like Amy's talking about, you can hone in on specific cases that you might be more interested in having impact on. Don't get me wrong, I think the parent part is super important. There's no doubt, but
Yeah, I feel like Wynn's pulling up that paper. I think it's been a bit, and I know we're the APSA committee here, but this may be even something that we want to do through AAP because I think AAP's really leaned into it. And really at the last AAP conference, there was Wynn gave it, Wynn and one of the anesthesiologists from Seattle gave a really good talk, a really great talk on like what surgeons can do. So it'd be interesting to see if like perhaps in a conference where it was stressed a little bit more, did that membership, and it was really well reviewed. And then there was a white paper that came out of it. Did that perhaps change hearts and minds? Though I know the initial study was through APSA, so apples and oranges, but
or do you mean
Mhm.
like take your survey and give it to the AAP membership? Is that what you mean?
yeah, just because AAP's leaned into it more than APSA has, and like the AAP has a position statement on it. When, right? Is that published?
It's not published yet. We're in, I know I keep on saying this, we're close
Yeah.
to the final round of revisions, I think. I don't quite understand the full process. Dr. Gao can probably give a little
Getting
more light on
close.
this.
It's getting
Yes.
close.
It's very close.
I mean, the only challenge with AAP is your AAP membership is half the size of APSA.
Yeah.
So knowing that you're going to get a, not great return on your survey, you're going to get half that number.
Yeah. I mean, it's the same people, so it'd be worthwhile to do again at APSA. Like, no one's part of AAP that isn't part of APSA, and probably vice versa.
Very small number.
Yeah.
All right. All right, guys. Sorry, we went 7 minutes over, but really good discussion. So thanks everyone. I will put together the minutes, send them out as usual. Okay. Bye.
Thank you.